This is a brief presentation about the LCDC exam, which is the certification exam for substance abuse counselors, and that's the name it has here in Texas. It is also known as the Alcohol and Drug Counselor exam by the IC&RC, and it is an international certification. This presentation is very brief. I will talk about the structure of the exam, the total number of questions, the number of questions on specific topics, and the types of multiple choice questions. There are 150 questions on the exam. 137 are multiple choice and they measure the 8 practice domains, and 13 questions are for the case history. 25 of those questions are non-weighted. The multiple choice questions have 4 choices, A, B, C, D. Those are the best answer plus 3 distractors. The test is 3 hours long, is computer-based, and it pretty much measures the 8 practice domains for substance abuse counselors. So this is how many questions there are for each practice domain. We have 24 questions for clinical evaluation, 20 questions for treatment planning, 10 questions for referral, 10 questions for service coordination, 33 questions for counseling theories, 15 questions for client, family, and community education, 17 questions for documentation, and 21 questions for professional responsibility. So this is pretty much what it looks like. As you can see, 22% of the exam is on counseling theories. Then 60% of the exam is on clinical evaluation, which is screening, assessment, intake, orientation. Then 14% is professional responsibility. The test really measures your knowledge on ethical responsibilities. Then 13 questions for treatment planning, and then less questions for referral, service coordination, client, family, and community education is 10%, and 11% is for documentation. Okay, so let's take a look at the multiple choice questions. These questions have the best answer plus 3 distractors. This format rewards recognition instead of recall. So you really want to study for situational questions and not for questions that ask for the meaning of a word or a concept. You really need to be familiar with the practice domains and the global criteria, because the questions are going to have situations where you have to recognize how to apply the different practice domains. So there might be more than one correct answer, but the questions, most of them ask for the best answer. There are questions asking for one correct answer, and then true and false questions as well, but the majority you will find that there are more than one correct answer, so just go for the best answer. So before you answer each question, just ask yourself, does this question have one and only one correct answer? And if the question has more than one correct answer, then how do I choose the best answer? Well, you can apply the umbrella principle. And this is when you choose the answer that covers the rest of the answers. And so this answer is going to be the most comprehensive one, the most inclusive one, and the most complete. Now for the 13 questions for the case history. These 13 questions measure the 12 core functions of addiction counselors. The 13 questions for the case history measure the 12 core functions of addiction counselors. And here we have screening, intake, orientation, assessment, treatment planning, counseling, case management, crisis intervention, client education, referral, reports and records keeping, and consultation. These are cross-referenced directly to the 8 practice domains. For the case study, you will basically have to identify each of the 12 core functions, and you will pretty much have a case study, and you will have to decide whether the core functions were conducted as they're supposed to be or if they were skipped. So read carefully, because maybe you're gonna have a case study where the screening process never happened, or the orientation never happened, or maybe there was a referral but it was not conducted as it's supposed to be. And you might see questions about ethical and professional responsibilities as well in relation to a case study. So just make sure that you identify whether the 12 core functions are there, and if they're there, if they were conducted correctly and appropriately, or if they were not done in an ethical manner. Here's a list of recommended readings that can help you prepare for the test. Some of these you can get for free from the SAMHSA website. The only one that you would need to buy is the one at the top of the list, Learning the Language of Addiction Counseling, but I highly recommend this book. It is my favorite book about addiction counseling, and it's very complete. Thank you for watching, and don't forget to subscribe.